Warm greetings to one and all. I am Raghuraman, working as a professor and head of the Department of Anaesthesiology, Sree Balaji Medical College, Krompet, Chennai. I would like to talk about basics of the anesthesia gas machine, which is now the pivotal in our day-to-day life, in our day-to-day practice. Once again, warm greetings, and I welcome you all for this session. So I'll be talking about the anesthesia gas machine. If you look at the anesthesia gas machines, they have evolved from the very basic, in which, say about some 2 or 3 decades ago, we could provide only the basic oxygen nitrous and few inhalational agents. But the safety features were very minimal in those times, and the ergonomics, the look, and the many sophistication now it has come. So if you look at the first slide, you will know the difference, how it evolved. In fact, now we call it as anesthesia workstation. So that contains not only the anesthesia gas machine, which is the basic is to provide the anesthesia gases and then other additional agents. In addition to that, we have the anesthesia ventilator, which pumps the gases to the patient's lungs, and then the monitors, many things like that. So the vaporizers. So that's called now as anesthesia workstation. That much it has evolved in, to say it evolved in leaps and bounds in the past 2 or 3 decades. Now we have so many electronic adjustments and then electronic alarms. Many things have come up now. Okay, the basics, it contains 3 portions. That is, the one is the high pressure, and the number 2 is intermediate pressure, and 3 is the low pressure. These 3 segments are there. So high pressure segments means mainly the cylinders, like oxygen cylinder, say about 2000 psi, and the nitrous oxide cylinder, say about some 700 psi. Whereas the intermediate pressure it focuses mainly on the pipeline, our pipeline supply, and then our flow meters and all. Then the low pressure circuit is the vaporizers. Flow meters, actually they are in the transition period between the intermediate and the low pressure circuit, say about 14 to 18 psi, like that. So vaporizers and then common gas outlet, all those come under the low pressure circuit. So the machine framework as such has the box shaped sections, either welded steel or aluminium. Okay, now the MRI compatible machines, main thing, are made in aluminium. Okay, mainly because of strength and the ease of assembly. The another advantage is allows for the upgradation. Okay, all the anesthesia gas machines are mounted on wheels with anti-static tires. It is a rigid metal framework on wheels, but there are some 10 total segments which we should know, and which are the by default it should be there in all the machines. That's the basic standards. So there are 10 important components of any anesthesia gas machine. First and foremost is the gas sources. It could be either from pipeline or from cylinders, but normally we have both. Okay, then the pressure regulators. It could be the primary, secondary, or flow restrictors. Okay, then pressure gauge, then flow meter, then system for vaporizer attachment, or called as vaporizer segment. So vaporizer itself is a separate topic which we'll need to talk elaborate. It will take It's a separate one. So I won't concentrate much on those things. Then O2 failure warning devices, back pressure relief valve, emergency oxygen flush, and then the common gas outlet. These 10 are the important and basic components of any anesthesia gas machine, whether it is modern or old. This is what it should be. Okay, now this is the slide describing the how the the nitrous oxide or common gases like nitrous oxide or oxygen, their pipelines are attached to the attached to the outlets, wall outlets inside the operation theaters. They have that also again advanced now. Previously we had Mark 1, Mark 2, now it has advanced to Mark 3 or Mark 4 like that. It's all according to that, as per the modification, now the fitting port and the attaching port they also changed now. Not. So coming to the cylinders, they have the yoke arrangement. They are common safety measure in that safety feature is pin index safe system, PISS we call it, pin index safety system, Bodox seal, and then filters and check valves. Ultimately the leak should not be more than 15 ml per minute through the open yoke. That should be about this one. And then the dummy cylinder heads. Coming to the pressure gauge are also one of the very important component of one of the important components of machine, because the pressure gauge only gives you the idea about how much particularly for the common life-saving gas, that's the oxygen. It shows the pressure, how much the cylinder contains, how long it will come. Okay. In case of pipeline, again there also the pipeline pressure drops. This one pressure gauge only shows us everything. So it's a Bowden type. It's a robust and it's inexpensive. The main advantage, it can withstand any amount of high pressures. It is curved. It has the curved flattened tube, elliptical in section. Okay, the mechanism might be varying, something lever or gear or rack and pinion mechanism like that. Okay, it effectively measures the absolute pressure. Okay, this is the Bodox seal, Bowden pressure gauge tube, how it works. And this part describes the how the cylinders are attached to the machine. The pressure regulators, why we should know why we should have in our anesthesia gas machine, their working principles, whether they are interchangeable or not, and what are the common faults, the types, they are primary and secondary. The third one is the flow restrictors. Okay, the pressure regulators are the most important, without which if you directly give, you know pretty well that it can damage the machine completely, and then it can cause also severe damage to the patient's lungs. Okay, so because of these two reasons, we have the pressure regulators. And then to make the flow in a controlled fashion. First and foremost thing, we all should know the basic goal of the anesthesia gas machine is to provide the intended gases, not the unintended gases. Okay, the intended gas, what I want to give. For example, I want to give only oxygen, patient should receive only oxygen. I want to give both mixture of oxygen nitrates, then patient should give both. Or additional emulsion agents such as halothane, isoflurane, sevoflurane, desflurane, whatever it may be. So all these agents should be supplied at the appropriate pressure at appropriate quantity. So this is the basic goal of machine. So pressure regulators play a very, very important role in any anesthesia gas machine. So there is no doubt about it. So the working principles are tension in the spring or elastic recoil of the diaphragm. That are a little complex, but the basic of anything is, we should know the basic physics is that if the same force is applied over a larger area, then the pressure is decreased. If it is applied over the smaller area, the pressure is more. This is the basic concept. So that much if you understand. So further physics, if you are interested, you can go through the textbooks. Okay. So previously in the olden machines, the pressure regulators were also color coded and now also color coded, but thing is they were coded for specific gases. Now the modern regulators, fortunately, they are compatible because the Teflon coatings on the diaphragm that can withstand any varying pressures or extremes of pressures. That's the main reason now we have the compatible pressure regulators to any gases, to any gas. So and then the nitrile valve seats, chrome plated brass body. Okay, but we should know the common faults in regulators, what can happen. So as anesthesia providers, the technicians, everybody should know the basic fault so that we should be alert and then try to address them immediately. Okay, so damage to soft seating valves that may cause steady increase in pressure. The pressure will keep on increase, but ultimately there won't be any gas flow. So that we should be careful. And then the damage to soft seating of valves that can cause steady increase pressure, but no gas flow. Already told you. The hissing noise that may indicate either a leaking or the burst diaphragm. Okay, then the sticking of lacy tongues of Adams valves, that is wear and grit, okay, or metal anything. So that can cause continual jumping of flow meter bobbin. So you will be, little awkward or a little annoyed whether the patient is receiving accurate flow or not. That will be definitely a question mark. So the fins on the N2 nitrous oxide regulators to conduct heat from the surrounding air to prevent the freezing of valves. Otherwise, the nitrous oxide, pretty well, there would be, that there will be under ice formation that can result in freezing of the valves, or valves can get stuck. So now coming to the second, now we talked about primary pressure regulators. Coming to the secondary pressure regulators, you already know why we should have another regulator. Already we have regulated the pressure. Okay, why should we have the secondary pressure regulator? Again, for example, in any hospital setting, it's called peak hours. For example, any institute, anywhere you can see, say about morning 7:30 to 2:30 or 3:30, whatever time your elective cases are scheduled, and you will be called the busy hours. Like traffic, you have also peak hours or hospital consumption of gases. So that time, and in addition to that, we all use the ventilators also. Pretty well, they are gas driven and they also consume so much of gas. So they can cause fluctuation by about 20%. So that is really a huge margin and can cause inaccuracy. So that's the reason we have the secondary pressure regulator, to reduce the pressure even to a proper, even more accurate level. Okay, and another reason is the mechanically linked anti-hypoxia system. They also can function properly only if we have the secondary pressure. Otherwise, during the peak hours, that time only it should work properly. That will be a problem. So to avoid that also, we have the secondary pressure regulator. Number 3 is to prolong the accurate supplying of any gas in case of cylinder emptying. For example, when the cylinder emptying, when the pipeline pressure is drawn, that time it should be properly, the pressure should be regulated. That's the reason we have the pressure regulator. So we also have the relief valves on any regulators, that is the safety blow valves. They are fitted at 70 psi safety limit, and then downstream of regulators it is 60 psi. Okay, the primary pressure regulators, their main aim is to reduce the cylinder pressure, particularly 2000 psi in case of oxygen cylinder, to the machine pressure, that is a 60 psi. But remember, the modern machines and all, they are called pipeline preference, whereas in the older machines, say 2 decades before, the machines, they didn't have this type of pipeline preference. So those time when the cylinder gets emptied, the problem is the pipeline also by the time would have got emptied, and we would not be knowing that the cylinder also both will get emptied and will be in soup. Now it is because now the pipeline preference. So that is why the pressure limit set is 50 psi only. So the pipeline preference. So anytime the pipeline only will be used. The cylinder pressure is little lesser. So the cylinder will be secondary only to be emptied. So pipeline, if it goes, then you will get the alarm immediately. You can inform the gas plant in charge and then correct it immediately. So that's the advantage. So now coming to the flow restrictors. This is in addition to the primary and secondary pressure regulator, we have the flow restrictors also. So they have the constrictors in the regulator pressure. So they are kept at the upstream of the flow meters. That is before the flow meters. Okay, upstream means before, downstream means after, towards the patient end, towards the machine end, like that you remember. Upstream means towards the machine end, downstream means towards the patient end. Okay, this is to make the flow of 150, maximum flow of 150 liters per minute. So, okay, so the thing is that if we use the machine, without regulators, so changes in pipeline pressure without flow restrictors, what will happen is the changes in pipeline pressure will be reflected on the flow meters also. So you will have the constant jumping of flow meters and you won't get the constant and accurate flow. Okay. Obstruction at the outlet may cause pressure in vaporizers and damage them also. Okay. So of course we have the back pressure relief valve for that, but still to prevent it only we have the flow restrictors. So now coming to the back bar. This is also another one of the important component of machine. One of the important components of the machine. So it also has the working pressures, and the safety features are spring-loaded non-return valve, so that it will make the unidirectional flow, and then the pressure relief valve. The limit is set at 30 to 40 kilopascals. Okay, remember we'll be talking about sometimes the PSI, sometimes kg per centimeter square, sometimes kilopascals, like that we will be changing the units of pressure. Okay, at the end I will tell you what are they. Okay, the back bar is a horizontal part of the frame that supports the flow meter and the vaporizers. So it's a cage mount taper system. For vaporizers we have the selector duct system, that's called selector duct system. Now another important features of the machine is the emergency oxygen flush valve. We call it oxygen flush, different term use, emergency oxygen, anything called. So it's basically it is a flow meter bypass valve it is. So it bypass the flow, joins a pipeline from the back bar just before the common gas outlet. Just before the common gas outlet it joins. So the minimum flow assured is 30 liters per minute, and usually the maximum is 65 to 70 liters per minute. It may vary from machine to machine. Okay, in the older machines, this was fitted near the flow meter block, resulted in initial surge of gas and vapor. So thereby, they also would also be delivered to the patient. Now those problem and all is now avoided in the newer machines. And there should be a locking facility, and the knob should be receded so that we can identify it easily with the color code, and many features are there for that also to easily identify it. So again, coming to the next important feature, the oxygen failure warning device. This also has gone through so many developments. It was introduced in 1950s. Now battery powered gas, so many advancements have happened in this portion of the machine also. Okay. So ultimately, whenever the oxygen pressure fails below the set limit, the alarm should be properly given. Both nowadays we have the visual and audio alarm. Okay, so that the technical persons and the anesthesiologist, everybody would be immediately warned, and they would take the necessary backup measures. Okay. So the basic guidelines for O2 failure warning device are gases less than 21% should be operated with a cutoff device. They should, progressively reduce the flow of other gases. And then gas cutoff device shall not be activated before the alarm. Okay, only first the alarm should be given, then only that should be activated. Okay, the duration should be at least of 7 seconds. Coming to the common gas outlet, that's the most downstream portion of the any anesthesia gas machine. It is the coaxial system with a 22 mm male, 15 mm female connector. The machines must have no more than one common gas outlet. It might be fixed or it might be swiveled through 90 degree. That's called the Cardiff swivel. Then it may contain some auxiliary gas sockets also. Okay, for oxygen or air to power the device such as ventilator or jet ventilator. So I already told you that you must know about the various units of pressure properly, because it is like the currency notes. Different countries use their currency. So you may be familiar with your currency. For example, we the Indians, we are familiar with our Indian rupees. So every time we need to know the conversion factor. It might be some of the countries, their value may be more than Indian currency, or some of them may be lesser than Indian currency. Similarly, so that's the idea I'm giving you. So similarly, the units of pressure also, it's varying. Okay, you may be adapted to only one unit. Okay, like Indian currency you are adopted. Okay, so you should know what are the other currencies value. Like this, similarly, you should know the values of the other units. For example, simply to remember, our atmospheric pressure is 760 millimeter of mercury. Okay, so that is equal to 1 kg per centimeter square. So first I would say it is equal to 1000 centimeter of water. Okay, 760 millimeter of mercury is equal to 1000 centimeter of water, or 1 kg per centimeter square. Remember, some old timers, old machines, still it will be written as kg per centimeter square. For example, 4 kg per centimeter square, that is equal to 60 psi. So, okay, like that. So these were just so if you don't know, then it's problematic only. So if you know the psi, how to convert it to kilopascal, that also is important. So 760 millimeter of mercury, that is atmospheric pressure, that is equal to 1000 centimeter of water, or 1 kg per centimeter square, or 100 kilopascals. So you know 1000 centimeter of water is equal to 100 kilopascals. So it's a 10 times difference. And then in psi it is equal to 15 psi. So 760 millimeter of mercury is equal to 15 psi, 1000 centimeter of water, 100 kilopascals. So all these 4 or 5 units, say 5 units, please remember them, so that somebody who is used to some unit, one unit only, so you can get an idea and convert it easily, and then come to the exact pressure, exact amount what they are conveying. Okay, otherwise, like money, you will be losing so much. Similarly, you will be giving some inaccurate pressures, or you will have the inaccurate understanding about the pressures used in the system. Okay, this is very important. You can't just neglect it. It's very, very important. So thank you all for your patience listening, and the reference, many of the points I have taken from the CS Ward anesthetic equipment. So you can refer them also for further reading. Thank you. In this talk, I have given the brief, rather the basic aspects of the Anaesthesia gas machine. Hope you all would have enjoyed the program and got some basic and some newer information. Thank you for your patient listening. Thank you again.